My name is Dr. Tianlai Tang. I'm the medical director at Nashville Brain Institute. Nashville Brain Institute is a new clinic that we established in 2019. We usually treat patients with depression. We also have some anxiety patients and ADHD patients. Depression is a quite devastating condition that interferes their family life, their job, and their communication with other people. Basically, their whole body and their soul will be affected, and it can make their life miserable. The mental health treatment is different from traditional medical treatment. If I treat infection, I know which bacteria cause the problem, so we can target that bacteria with a particular antibiotics. But for mental health treatment, it's a quite different scenario. The challenge of our practice is to find a good treatment for our patients, especially if we use the medications. If the patient has both depression and anxiety, they may use one medication. If a patient has depression plus sleep problem, they may treat with another medication. We try to individualize the patient's treatment plan because each patient is different. Their genetic composition is also different. It's very hard to predict how does the patient respond to the medication without knowing their genetic profile. Before the genetic test, my approach to the patient usually based on their psychological history and their family history. For example, if the patient's mother has depression and was helpful on any particular medication, I then probably will recommend the same medication to the patient. But sometimes could be right, but sometimes could be wrong. Usually, I order the GeneSight test based on their previous response to the medication treatment, and also based on their mental health condition. For example, if the patient is young, especially for the teenagers, I probably will do the genetic test because the young people has even worse unpredictable response to the medication than the adults. And some medication can even make them feel suicidal. But with this tool, you can say to the patient, look, we get this a new treatment option that we can collect some genetic data from you and helps us to understand which medication can fit your body better than other patient. I like the GeneSight test because it helps my patient and also helps my practice. It helps me to select the medication much quicker and make the patient feel much rewarding and happier to come to see me.